when the during ovulation time, and you can have spotting when the baby is trying to attach to the womb. But these are far and in between. So there are those two times, the time of menstruation and time of during childbirth. These are the two distinct times that bleeding from the vagina is normal. Any other time, any bleeding at any other time from the vagina should be regarded as a very serious issue, especially bleeding in pregnancy. So if this is happening, you need to see the doctor immediately. Question: if a lady's period is irregular, does that mean she is not fertile, sir? If she sees her period every 3 or 4 months, of course, period coming every 3 or 4 months is not good. But one thing is may be a problem here. When a lady begins to have irregular menstruation, many of them also do not ovulate. And you know that if a lady does not ovulate, there is nothing for the male sperm to fertilize. Therefore, infertility can be an issue here. That is, the chance of achieving pregnancy will be much less, and you need to see a doctor for correction. I want to thank you very much for listening, and I hope we have laid the ground for further discussions of menstruation, and I hope that we have all learned one or two things that we can use as agents of information to our family members, our peers, and in our community. The next topic, like I said, is also very important, and I think I should go through them. The next one will be irregular menstruation and pain during menstruation. That is the next topic. The third, that should be part 2. Part 3 is scanty menstruation and heavy menstruation, and part 4 is no menstruation at all, which doctors call amenorrhea. I thank you very much for listening, and I hope you have enjoyed this talk. I hope to see you. Please connect with us on Instagram and Facebook. You can also share questions, which I'll try my very best to answer as many as I can. But like I said, let us get to the bridge before we cross it. I'll rather defer some questions that pertain to sections that we have not covered, so that when we cover them, we also have knowledge of why the answers we are giving. Thank you very much, and good night.